Welcome to our podcast. This is Real Talk with Mary Contrary and Starfish. Welcome to Real Talk with Mary Contrary and Starfish. Today we are going to talk about this episode called Medicare in Crisis. So this episode, we're just going to break down the Project 2025 and Trump 47 agenda and kind of talk about how their plans are going to affect Medicare. So what I'd like to do first is kind of go into the history of Medicare. And Starfish, you've done a great job kind of outlining this because there's a lot in here that I didn't even know about Medicare. So it's kind of fascinating.
There's stuff. Medicare's like super fascinating. I was like, oh, interesting. Huh.
Right. Yeah.
I just even forget like which is Medicare and which is Medicaid. I mix those up even. So I was happy to finally get that straight in my brain, you know.
I know. I think a lot of people get that confused. And so Medicare is like basically for seniors. Medicaid is for low income folks that need a little extra hand, you know, that kind of stuff. So yeah. So anyway, so Medicare, it started in July of 1965. President Lyndon Johnson actually enacted Medicare. So it's basically for people age 65 and older, as we all know, regardless of income or medical history. So Medicare has actually been operating for almost 60 years, and it's undergone probably about 7 major changes since 1965. So the program's provisions have expanded to include benefits for speech, physical, and chiropractic therapy. That was in 1972. Options of payment to health insurance organizations, so HMOs, hospice benefits to aid elderly people in 1984, and then expanded in 2001 to cover younger people with which I think this part is great for people that have ALS, which is a terrible disease, or Lou Gehrig's disease, another terrible disease, and younger people with permanent disabilities who receive Social Security disability insurance payments, and those with end-stage renal disease. So Medicare kind of helps cover a lot of stuff. I think it's a great social program. But as we move along, we're kind of gonna go like kind of analyze it. It unfortunately is one of the biggest federal deficits that we have too. So we'll get into that as we go. So
I wanted to know, can you clarify like why is ALS, Lou Gehrig's, and I mean, end-stage renal cancer makes sense to me.
Right.
It's the end stage, but is ALS and Lou Gehrig's basically the same, very terminal, terrible?
Yes.
Like you're basically going to die.
Yeah, those are, unfortunately, I had a friend on Facebook, their partner passed away from ALS. Aww. Very terrible, sad, bad situation.
Young.
Very young. Hit him at the age of 50, just took him right out. Unfortunately, when you get diagnosed with that, there is no cure for that. Basically what happens is your connective tissues just break down, and it makes it so you basically suffocate to death because you can't breathe anymore. Like it just affects your entire, it's an awful disease.
Oh, okay.
Yeah.
Okay. Well, that makes sense that it would be part of Medicare then, because you're almost immediately on hospice, right?
Yes. Oh yeah. It's it's once you're diagnosed with that, it's like you got months to live. It's very sad.
Oh, brutal.
Yeah.
Solve your whole life in months, finish it all up, wrap it up.
Yeah, exactly. And just absolutely terrible. So I'm kind of glad that there is a mandate in there for people that are in that very unfortunate situation of those terrible diseases. So anyways, but that's basically the history. Like it's also divided into 4 parts, as a lot of seniors and people know. Parts A, B, C, and D. So Part A covers hospital, skilled nursing, and hospice services. Part B covers outpatient services. Part D covers self-administrated prescription drugs. Additionally, Part C is an alternative that allows patients to their own plans with different benefit structures that provide the same services, such as Parts A and B, but almost always with additional benefits. So, and then some of the specific detail, like so Part C, it's like an alternative, often called managed Medicare by the trustees, and almost all of which are deemed the Medicare Advantage plans, which we're going to talk about that also in detail on this, because it kind of gets into what the Project 2025 and the Trump agenda, really kind of get into that section a little bit with that Medicare Advantage plans. And I wanted to ask you, Starfish, because like you had mentioned to me that your mom has the Advantage plan, right?
Yeah.
And it's you're like
so as you know,
tell
as I
us
was
more
reading this,
about
I'm
that.
like,
Yeah.
well, and as I was reading about this, I knew my mom was on Medicare because she had told me, and she's of age. And so I don't know much about Medicare because, I'm like 40s. So why would I don't know. I see it come out of my paycheck every week, but whatever. And I just called her up. I'm like, Mom, are you on Medicare or Medicare Advantage? And she's like, oh, I'm on Medicare Advantage. And I was like, oh, okay. Cool. Like, did you know that's not really Medicare? And she's like, what? So no, she had no idea. She was not really on Medicare, but she was on Medicare Advantage, which is just an approved plan through Medicare. You're paying for it. So she's paying like $120 a month for this freaking plan, even though she paid into Medicare her entire career. Her entire 40-year, 50-year career, right? Like, why are you paying for it again save your very little money that you get from Social Security for enjoying your life, not paying for your stupid health care. I mean, she decided ultimately to keep it, and we'll get into why, but it's just weird. I was like, okay, well, at least she knows now that she's having to pay for something she could get for literally free.
Yeah.
Yeah.
So yeah, it's like, we have these social programs like Social Security and Medicare, Medicaid to help people. And it's like they're just trying to nickel and dime us on everything, Starfish. Like that's what it feels like a lot of times. So
yeah.
Anyway,
well, I wanted to mention too that you had said the trustees. So I got this intro part from Wikipedia. It's I didn't do some great research on it, but Wikipedia is actually a pretty good place to get research like this. But they mention the trustees. So the Medicare funds are managed by these people, trustees. They, if you know anything about finance, they're just entrusted to manage the fund. They don't get a take from it or own it or anything. So when you said trustees, and I think we mentioned it a couple more times in the show, just so people know what that means, trustees. Also, I loved to hear a couple other pieces of history that I don't think I put in here, which was that this used to be Medicare used to just be for military families, which was like, oh, okay, interesting. Yeah. And then then LBJ expanded it in the Great Society. That's what that was the name of his plan. So like the New Deal, his was the Great Society. So that's why he did this. Also, a little bit I did put in here, and we just talked about equity, so I thought this was pretty cool, was that in 1966, and you can just imagine the time, right? We're in the 60s, Medicare spurred racial integration of thousands of waiting rooms and hospital floors and physician practices by making payments to healthcare providers conditional on desegregation. So if you want to have anybody use Medicare in your practice, you have to allow anybody to use it. You can't say, oh, only whites allowed. So I thought, so all these people are suddenly sitting in rooms together like, hi.
Right.
I thought that was great.
That is great. That's fantastic. And was the start of some of that civil rights stuff. So that's good.
Well, that's exactly what the purpose of all of this is. I mean, that was just such a shining, it's hard to see anymore, but that was such a shining example of how you're immediately equalized, and they just never were treated that way before. So I loved it.
Yeah, that's fantastic. So, well, let's get into like the Trump and Project 2025. What they're idea and plan is around this.
Yeah, so we talked on the last few episodes about Trump's involvement with this, so we're not going to mince words anymore. We know he's involved. So anybody who questions that, go back and listen to that episode. It was a couple episodes ago, but definitely they're involved. And what you can see is that in Trump's Agenda 47, he calls it, or the GOP platform, whatever, that Trump says things very sort of loosely. Like, for example, he says, President Trump has made absolutely clear that he will not cut one penny from Medicare or Social Security. Okay, well, that sounds wonderful. And everybody's like, great, I'm going to vote for President Trump because he said he wasn't going to cut anything from my Medicare or Social Security. Well, as we get into the details of Project 2025, which explains the actual plans, we know that that's not really true. So the other thing he says in his agenda is Republicans will protect Medicare's finances from being financially crushed by the Democrat plan to add tens of millions of new illegal immigrants to the rolls of Medicare, which isn't true on the federal level, by the way. That's a state level thing. So every state has the option to run their Medicare the way they want. They just have to follow the federal rules, and they are allowed to bring on illegal immigrants if they want. You can do that. So California did that, for example. And of course, everybody hates California. So they're like, well, whatever, the liberals did it. But, choose how to use your money, how you do, states. That was the whole idea.
Mm-hmm.
So what I found interesting was that particular thing, Republicans will protect Medicare's finances from being financially crushed, was kind of one of the biggest things that Project 2025 focused on. I mean, that language is literally directly from Project 2025, because you can see that immediately Project 2025 says Medicare must be reformed to ensure it's financially sustainable for future generations. I mean, literally, that's like the same thing that Trump said. So, we're talking about the finances,
right?
Basically. So you brought it up in the intro that Medicare has major financial problems. I did not realize just how much it had. It's essentially, so the trustees do these like actuarial things every once in a while, and they calculate how long it's solvent. So they have this basically big fund sitting there with money, and they're paying out to people, and as soon as it goes so that we're paying out more than we're getting in, it's insolvent, right? And we're getting money in from payroll taxes and interest and things, but the problem is they've borrowed against it, so the interest isn't so hot, right? So that you're not gaining as much interest as you would had you just left it there and not borrowed against it. Which I think they do with Social Security more. Every president has done it.
Yeah.
But still, it's disturbing.
It's wrong to do that, by the way. Like, you're basically stealing money from the public when you do that stuff.
Right. But I thought this quote from Project 2025 was particularly funny because it's just like ignores all the other things that are contributing to the deficit in the United States, namely, defense. Because it's written by this guy named Roger Servino, and he was the director for the Office of Civil Rights at the U.S. Department of Health and Human Services. And he was appointed by Trump to lead the OCR at HHS. So, again, like the fact that they think that Trump has nothing to do with this is just hysterical. So,
yep.
So he, this guy's just a real, he works for Heritage Foundation, and he was trying to take away, enforcing civil rights and laws in healthcare settings, including those related to non-discrimination, religious freedom, and the privacy of patients' health information, whatever. So religious freedom, of course,
Right.
So anyway, in Project 2025, he says, when our founders wrote in the Constitution that the federal government would promote the general welfare, they could not have fathomed a massive bureaucracy that would someday spend $3 trillion in a single year, roughly the sum combined spent by the departments covered in this section in 2022. Approximately half of that colossal sum was spent by the Department of Health and Human Services alone. The belly of the massive behemoth that is the modern administrative state, which we talked about that on a previous episode too. So HHS is home to Medicare and Medicaid, the principal drivers of our $31 trillion national debt. I'm like, the principal drivers? So then he says, Medicare and Medicaid combined cost 17.8 trillion, while our combined federal deficits over that same time span were 17.9 trillion. In this essence, our deficit problem is a Medicare and Medicaid problem. I'm like, okay, just because the numbers match up doesn't mean that the entire problem is Medicare and Medicaid. Now, there's problems with them, but that just pissed me off.
Yeah.
It's so disingenuous.
Right. It's like, well, look how much this healthcare cost us, with people that are aging. Well, what do you expect? Like,
right. And also they're paying into it. It's a freaking entitlement. So don't tell me it's not, don't tell me that there's a $17.9 trillion because it's been negative. That's not even true. That's not true. It's just, so we still have a solvent account, and for at least 10 years, I think was the projection. So it's not like, I don't know. It's just, I just get so frustrated with them when they say things like that, because it just, for simple minds, clicks like, oh, Medicaid is costing 17.8 trillion and we have a $17.9 trillion deficit. Therefore, Medicaid problem probably caused it. But that's just absolutely not true, So it's just frustrating when I hear things like that. It ticks me off.
Right. Because it's like, you're not looking at the defense deficit.
No.
Or the other
defense
federal
spending
crap.
is way bigger.
Right.
Now, what I will say in their defense is that Medicare fraud is terrible and rampant, and we spent $130 billion on false or wasteful. We spend $130 billion every year on fraud.
Wow.
That is people signing up for Medicare fraudulently, with fake accounts or dead people's information or whatever. And I mean, $130 billion is a crap load. So each state basically, I think the state of Colorado, they paid out over 100 million or something like that, just
Holy
themselves. Shit. I know. So there's a lot of efforts to make the fraud stuff go away, but we'll kind of get into that a little bit later. But I think that's just the fiscal part of it is like, okay, whatever, lies again.
Right.
But some of their plans to help fix Medicare, or the plans in 2025, are to reduce regulations. Of course, they want to take away all these regulations. It says what makes me laugh so hard is it says reintroduce and restore regulations and demonstrations from the Trump administration that were withdrawn, weakened, or never finalized by the Biden administration. One more tie to Trump. So we have evidence he already tried to do this when he was in office. Like, how can you deny it? I got to get over it. But man, it just bothers me so much. So there's a bunch of rules here that I don't really understand, and I'm not going to go into, but there's a bunch of ideas of ways to sort of reform or take away the regulations on healthcare, which I no doubt are probably scary and not good if I were to dig into them.
Right. So their plan is to basically, this is where I was kind of going with that Medicare Advantage. So what they're trying to do, because we just talked about it currently, it's like it's a supplemental thing currently that seniors pay for. Mm-hmm. But with Project 2025, what they're doing is they want everyone to be on the Medicare Advantage plan. Is that correct? Like, it doesn't matter who, like, everyone just has to pay a monthly premium basically to get Medicare. Is that what I'm understanding?
Correct. So that is their next solution is, okay, so let's take away all the regulations and let's privatize it essentially. Encourage more direct competition between Medicare Advantage and private plans. Medicare Advantage, a system of competing private health plans, is the major alternative to traditional Medicare. So what they want to do is, on page 464, it says critical reforms are still needed to strengthen. Specifically, make Medicare Advantage the default enrollment option. I mean, that is one little line that is buried in this thing that freaked me out. I went, what? So they would automatically enroll my mom in that program. And then she definitely wouldn't have had a clue that she could have done Medicare, just without
Right.
paying for it. So she pays $120. It's to Cigna. It was 80 and now it's 120. So it's already gone up $40 since she started.
Wow.
So
And
that's
how
the
long
other
has she
thing is
been
they can
doing it?
change it. She's been on it for, I think, 5-6 years, maybe.
Yeah. And I mean, if you're on a
Not that long.
fixed income, that's a lot of money.
Right. $40 a month. I mean, you're just, cutting away at them in every way you can. Right. Like, and it's
Yep.
Cigna. It's a private company. So basically they just have an approval. Now there's good things about Medicare Advantage. And if you're like my mom, it was a better option for her because Medicare is not great with dental and vision and prescriptions. Although with the new laws out there, which are next, it did lower the price of a lot of medications. So she might consider going back, but she has big problems with her teeth and the dental plan is better with Medicare Advantage. So I'm like, well, get your teeth fixed and get off of this thing so you don't have to pay for it anymore,
Right. Yeah, exactly.
So
So
that's really
that's
disturbing. I think it's disturbing to automatically enroll people in a paid option.
so yeah, so not only are they going to force you to pay for it again, even though you've been paying for it your whole life, then they're also making it more expensive. And there's probably there's probably nothing written into this where they're going to regulate the monthly cost, right? They can just
Oh no.
up that whenever they feel like it.
Because they're beholden to their money and the private donors, So of course they want their insurance buddies who gave them all their money to get their money back. I'm like, it's just so transparent, the whole thing, when you really start looking at it. Another thing they want to do, which of course we know exactly what this means, is base payments on the health status of the patient or
Oh my
intensity
gosh.
of the service rather than where the patient happens to receive that service. I was like, excuse me, what are you actually? I just really wanted to. Are you telling me that a person, again, who's been paying into it their whole lives, and of course they're going to need it. They're in their 60s, 70s, and sorry, you've had a pre-existing condition. You're going to have to pay more. That's just the way it goes. You use more, you pay more. No, this is how insurance works. We all pay the same amount, okay? And we dip into it when we need it. They've not had these experiences in their life where they can't pay for it because, they don't realize that regular people like us can't afford what was it that you guys might have to pay, like 50 grand for a very essential surgery to make your lives
Yeah.
significantly better.
Yes.
They don't understand that amount of money is insane to me. I could never afford that ever.
Oh
And
yeah.
it has
Yeah.
nothing to do with me being an unsuccessful person in life or anything like that. It has everything to do with the cost of healthcare being outrageous and them wanting to fix it by just putting it right back on the patient. No.
And I think that's really what every company in America wants. And I just want to comment. I mean, just because I'm in the healthcare industry, and it's this system that we currently have, I think, is a disaster. So there definitely needs to be a reform on healthcare in America. And I don't know exactly what the answer is. I mean, there's been Medicare recommendations out there, but like just what's going on currently from even like in like personally, it's just like I'm seeing where and this has happened to friends of mine, it's happened to me personally, where you'll go for a necessary surgery or procedure that you need to have, and the insurance company will deny your claim the day before. Like they send out a waiver that for you to sign, so hoping that you'll sign it so that they're not responsible for anything and they just put it back on you. So they're
Ugh.
trying to be sneaky even now. So if Project 2025 went through, that just opens up the door for more of that, in my personal opinion, to happen, to where,
Right.
we're just going to automatically just put that cost back on you, because we've decided, that it's not going to work. And I'll tell you, I have a coworker that she used to work for healthcare insurance companies, and she
Mm-hmm.
said what they do is they hire these crappy doctors, these are bottom of the barrel people, to sit in a room and decide if a certain procedure for the certain patient is necessary or not. And I really don't think that's correct at all. I think that should be between
Mm-mm.
the doctor and the patient to decide what their treatment options should be and what direction to go. I really don't think that should be on an insurance decision. And that's really where, I'm calling on Congress, like every one of you bastards, to look at this.
Mm.
And you
Yeah.
need to start passing regulations here on some of this. Like, you guys need to do something. You're telling us to do something. You need to do something, because I just can see this going so many different ways. But I feel like it'd be more destructive with Project 2025 if that happened, just because that's just opening up a can of worms for older Americans. And
Mm-hmm.
all I'm
Mm-hmm.
seeing as far as recommendations, it's like they want to increase payroll taxes. Well, we're already paying a crap ton of taxes, so let's go ahead and add some more. So they want to take more out of our paycheck for Medicare. They want to raise this is the one that pisses me off a lot, is raising the Medicare eligibility age from
Mm-hmm.
65 to 67. And they're trying to do that with Social Security too, and I just
Mm-hmm.
don't agree
Mm-hmm.
with that, honestly. Like, I feel like,
Let's just keep pushing our retirement back. Let's just
yeah,
work more and more and more. Mm-hmm. Mm-hmm.
yeah, so
I
that
mean,
we don't
Bernie
have to.
Sanders has even recommended that. It's like, is that really the trustees? That's one of their biggest recommendations, is to up the Medicare eligibility age. Yeah.
Yeah, instead of just like
So
managing it correctly.
what I mean, so we use AI on this channel. We've talked about it before on this podcast, because it's a very helpful tool for helping us research and understand sort of some of the big proposals out there. And yeah, those are a couple of them. But what would what would be your proposal for fixing this problem? I'm curious, because mine is single payer. And the reason mine is single payer is because the government can negotiate the prices that way. They can set the prices. They just did it with the Inflation Reduction Act. They changed the drug prices negotiation program. So entirely changed it so that we set the price. You don't set the price, because obviously you guys go a little bit extreme. So they're charging $600 for a shot of insulin, and now they're
Right.
charging $35. And that is insane. Now,
Well,
that is only for Medicare people. None of the rest of us get to pay that lower price. So I'd like the government to negotiate for me too. Then it seems like they did a pretty damn good job. And so that's my idea. And that's what other countries use too, is single payer, because you can
yeah.
negotiate all the prices, and the prices are going outrageous. They're just too much.
Well, in the
Why are they so much
hospitals,
more expensive in here in the
the
United States, and we don't even live as long?
exactly. Well, and the hospitals and clinics out there, they're taking advantage of that, because they're like, well, I'm going to charge, when you come into the ED for something simple, we're going to charge you $100,000, some ridiculous amount for, and these are people coming in for maybe like they have like a cold, like a bad cold or an infection, whatever. And they're being charged these astronomical fees that the insurance companies are having to kick out. Like, there's just not enough regulation in this.
No,
And I
no.
agree with that. I think what we need to do is we need to have set prices for everything. Like, this costs this. When this happens, this
This
costs this.
costs this. Why is this
Like,
a debate?
yeah, why are you charging this patient to be seen all this money just for like a
Yeah,
simple procedure? Like, it's just it's
right.
crazy to me. Like, if you look at hospital bills, like if you've ever been hospitalized, it's like totally outrageous if you look at the cost of like the surgery and everything that
Oh
they're
yeah. Oh
billing to
yeah.
these
I mean,
insurance and
giving birth
Medicare,
cost
Medicaid.
me giving birth cost me like $100,000. If I didn't have insurance, I wouldn't. I mean, they estimate it to be like $50,000, but it's more because you could have problems, you know, so you have to go to the hospital a lot or whatever. So I mean, these costs are just way too high, especially when you compare it to other countries. Like, why is it just so high here compared to other countries? Like, all of Europe
Well,
has a single payer system, and they're not paying anywhere near the amount that we're paying.
well, and I'll tell you too, what I think is also part of the problem is what I'm seeing in healthcare, working in healthcare, is they hire all these middle managers, they hire all these unnecessary roles in executive management. Like I call them the C-suite, you know,
Mm,
the suits that sit in their ivory tower
mhm.
and God knows what they do all day in their office, probably nothing. And
Same
they're
thing in
getting
higher ed. So annoying.
right, right. It's like they're getting paid all this money from all of this charging patients ridiculous amounts of crap, and they're not doing anything. And then the workers are making pennies on the dollar compared to the doctors and the executives. You know,
Mhm.
it's just totally asinine. I mean, uh, I have doctors that are making about 7 times what I make, and they
Hmm.
have the nerve to tell me that I'm expensive. So, kinda had it with that bullshit. I'll tell you that. So that's part of the problem. You have all the, you know, it's just like every other company in America now, where it's like all the C-suites are making all the money off of the backs of all the
Yep.
workers and the patients. And so
Right.
we can't get, you know, supplies that we need to do our jobs, equipment that we need to do our jobs because of the greed of the C-suite executives. And once again, we're seeing all this bullshit put out there by even our current government plus Project 2025. I mean, I can go on this tangent for days. It just pisses me off so much that it's like, you know, it's just beneficial to the one percenters or the top earning people. You know, it's
Yeah.
like you, if you got rid of some of these C-suite people, we might be able to like treat our patients a little better and our staff a little better if we pay them what they're worth, because they're the ones that are making money. Like whenever I show up to a shift, I make I make the company at least $30,000 or more in a day, Starfish. I get
Wow.
a small fraction of that. So
Yeah.
like this shit can just fuck off as far as I'm concerned. You know, healthcare is just that's how I feel about it. I'm pissed about it. You know, that
Yeah.
this is something that it goes deeper. It's deeper than Project 2025 even. Like it's both sides. Both sides need to do something about this. But
Yeah. And I looked at the Democrats' plan, and I consider myself left leaning and everything, but I don't know that they have a great idea for it either. Because
right.
you can't just I mean, the only way to really do it from the government's perspective anyway, from the only power they really have is to control costs of government funds, so that if you're receiving any kind of government assistance, then they can control those costs. But any private funding or any, I mean, they have such a hard time. Actually Kamala, while she was the attorney, I think she was attorney general in California. Anyway, when she was in California working, she she was able to lower the costs of things by like nailing people on price gouging,
Yeah.
which obviously was done with insulin in particular. So that's good. We know that there's something she can do. I mean, a lot of states have price gouging rules that you can't have it go up over 10%, especially in times of crisis or something like that. I was looking through a
Yeah.
bunch of them, but things like that might help, but still, they're still just too expensive in general anyway. I mean, a 10% is good. It's a nice start, but I don't know. I'm biased. I feel very strongly about single payer. It's just so much easier. It cuts out a
I
ton of
agree.
paperwork and
Yep.
middlemen. You're not dealing with the insurance company. But people talk about the government being very inefficient, but it's better than being extremely overpriced. I don't know. I'd rather take a little bit of inefficiency than have to pay for it. Because basically I've been on Medicaid, and we aren't talking about Medicaid, but I've been on Medicaid, and it's a hell of a lot easier than people think. Like I had to do it while I was pregnant because you have to be on healthcare. You have to have a healthcare plan in the United States or else you get fined. Plus I was pregnant. So I was like, okay, I'll just go ahead and be on it. And I mean, I didn't have any problems finding doctors or getting things paid for. Now, what I will say, there was a couple things that they did differently that I noticed when I was pregnant again, that they aren't as willing to pay for like a 3D x-ray of your baby. Like when you go get a sonogram, it's a pretty crappy image because it's just a black and white, 2D image. But when you get a 3D image, I actually think they're creepier, but they're more expensive.
Right.
So
Well,
I noticed that little things like that where I was like, who cares? What's a big deal?
Right.
And
Right.
like
But
genetic testing, they did all this genetic testing on me too. So, but Medicare could still pay for all that, or Medicaid, So Medicare for all, that's my plan.
yeah, I think that that's a good idea. And if we can regulate the cost of things, then we wouldn't have all this other bullshit, or have some doctor in a dark room deciding whether you can have a procedure or not with the current healthcare systems. And I'm seeing a lot of health insurance companies that are getting dropped off of major carriers. That's happening out there right now. Like they're just like not renewing their contracts. There's certain systems that aren't taking, like big carriers like Blue Cross Blue Shield, which is a huge one. United Healthcare is another one.
Wow.
It's just kind of crazy to me that is happening right now in America. So this is something that, like I said, I mean, this does go deeper than Project 2025. But like I said, if we past 2025, let's just say they're in, this will actually erode all of this further. It's going to make it worse overall.
It'll make it way worse. They just want to take away these benefits. They don't want us to have public health benefits, basically. They just want you to be self-sufficient, figure it out yourself. I mean, I know a lot of people who are conservative, and they just go without insurance. They just don't have it. And they just think they're going to be fine. And now they're getting in their 40s, 50s, and they're starting to realize, damn, because they hurt themselves, they have to go to the doctor, and it costs $800 just to see a doctor. It's like, well, why aren't you on insurance? Well, their jobs don't pay for it or whatever, and they are willing to take the hit, the fine. It's just like, okay, I hope you don't get really sick and then your family's screwed. That's what I hope, is because every one of them I know that doesn't have insurance is going to get ill or sick or die, and their family's going to be screwed. Period. It's just the way it is.
Right.
They're not going to have the income coming in anymore. So I hope they're okay. I don't know. I need insurance. I absolutely need it. I have a lot of health problems, mental, physical, all the things. So, and I know that's not helping at all. I know that chronic diseases and aging populations are a problem, because then we got to pay for them. Like, I always think about the baby boomer generation kind of working their way through this pyramid. When you think of like, people who are babies versus people who are old age, it's supposed to be a pyramid, that the people who are old age, there's fewer of them than there are babies. Well, the baby boomers flip that. There was more babies than there was any other age range. And it continued all the way up. There's still more of them than there is millennials. There's more of them than there are Gen Z. It's bizarre. The triangle is broken. It's now a triangle with a giant bubble moving through it. And once the bubble goes away, this will be recontrolled in 40 years. The bubble will go away, but we still have to deal with it for now. And it's not going to fix everything, but it is certainly, boomers were a big contributor to this problem, and Social Security. Nothing they did. They were just born, but there was just so many of them. It ruined any of these plans for how they would work, because there's not enough people feeding into it to pay for them. And they're expensive. They're living longer. They use more, like my mom gets crazy procedures done, crazy things that, like, her grandma, my grandma never would have gotten done, So I think the expensive, we're eating crappier, we're living our lives crappier, we need more health insurance. So certainly, taking more of a preventative approach is probably a good idea too. The government or us taking a more proactive approach, but it's healthcare is just such a conundrum. And I know people in Canada, like I have family in Canada, and they talk to me about it a lot. In fact, they bring it up. It's hysterical. They're like, "So how's the healthcare system going?" And they're conservatives there. They're considered conservative. They vote conservatively. They're not liberals, but they're like in Canada, a liberal or a conservative is like a liberal in the United States. So they just like apparently one of my family members got really injured on a railroad and lost his legs. Well, in the United States,
shit.
they put you in a wheelchair. They put you in a wheelchair in the US or whatever you can afford, but the wheelchair is the cheapest. So most people go for a wheelchair. In Canada, they put him in those cool walking stilt things, like the prosthetic. It's not a prosthetic, but those. And you can't even tell. He wears them. He's had them since he was, 18 or whatever. He's pretty young. He got hit by a train very young, and he was working for the train system. So it's crazy. Wow. Anyway, I know, but they pay for the whole thing. They've paid for all of his physical therapy, everything. He's never had to pay a penny. And it's like, it blows my mind. I know, fully restored, fully recovered, and he's not in a wheelchair. I think that's a huge, people don't realize how hard it is to live in a wheelchair. What a life change that is. Now you're in a wheelchair. Oh, so sorry. But if you can have your life back and walk around and do activities, it just feels different,
Right.
So
yeah,
it just bothers me that, people talk about these other countries like they have some problem and they all laugh at us and how terrible our system is. It's just bad. So bad.
It is. It's just absolutely. Healthcare is 100% driven by greed, and it is current. It's like I witness it firsthand every day. It's very frustrating to work in those conditions because you're just expected to do more with less and less, less resources, less help, less everything. But here's all the people that you have to get through, get them through quicker, faster, better. All this bullshit is thrown on to the workers, and all the exec suites are out golfing all day like a bunch of dicks. So I've just had it with that. I've absolutely had it with that in America. So it's like, this is where you guys can make a difference and take back, vote correctly, force Congress to do their job, write to your local Congress districts. I'm like, get out there and shake the shit up. Cause the politicians are just not doing their damn jobs.
No, even locally. Yeah. I mean, Colorado has a expanded Medicare, Medicaid system. That was another thing. Well, that's for Medicaid, which we weren't talking about, but yeah, they just want to reduce the eligibility rules too for it. It's like, it's just,
instead of expanding and doing it correctly, controlling the price of things, we're just going to cut everything even further. That's their solution. No. That is a shitty
keep
solution.
Their rich friends rich, themselves and their friends rich.
Yeah,
that's all it
is. And I've just had it. It's so bad. I've had it with the mentality of this 1% mentality that we have around all this, and that like I've said in every episode, that's what Project 2025 is. It's for the 1%, and as we go through the
conservative agenda is.
It's just. Yeah. And it's amazing to me that these people that are like the working poor are so blind to all of this. And they're just so willing to throw away their rights like that. It just completely floors me daily. Be those
people someday. If I just work hard enough, I'll be rich too. No, not that rich. Believe me.
Right. Oh, yeah. If it was that easy, everyone would do it. So.
Well, this episode made me cranky. I'm so sorry, everybody. I feel like I have been grumpy about this week, just like, this is a total scam.
Oh my God. Yeah, it really is. I really do feel like healthcare in and of itself currently in America is quite the scam. So
it is. It's a massive scam. Massive.
Yeah. Oh, massive. And like the 2025, as we broke down, not going to make it better, folks. Really isn't.
No.
So
no, nor is Trump. I mean, his plans don't even make sense. You can't, he's saying take all the illegal people off of Medicare. That's not even happening at the federal level anyway. So it's all just empty words,
Yeah.
And yeah,
Yep.
you're not going to cut Medicaid, but you sure do, or Medicare, but you sure do support putting people on the private plan. And that's kind of were you not going to announce that? Of course not. It's very unpopular. Nobody would want that. So that Agenda 47 GOP platform is basically bull. It's a bunch of bull. It's just a really light. It's like my little kid could read it. It's very easy to read, and it's just so basic. It's like, yep, they were playing to their audience.
Yeah.
I hate to say it.
100%.
Anyway, good episode. Good episode.
Yeah, it is. And you know what, folks? I'm going to say it again. You guys got to get out there. You got to make a difference in your communities. Please vote. Please try to vote for people that are going to help us, not people that are going to go against what the people want. It's like we all want to live our lives worry-free. We want, we want a fair education. We want fair healthcare. Those are all things that are very important. So,
Fairness,
quality. So absolutely. Yep, definitely. So when, like I say, every episode, stay safe and stay informed. Thanks everyone for listening to Real Talk. Don't forget to subscribe to our podcast wherever you listen. We look forward to having you on our next one.